Good morning, everybody. This is Dr. Jeff from Regenerative Medical Group and Regen Ocala. Many of you know me from Regen Medical Group, but recently we have opened a clinic in Ocala, Florida, and I have 4 practitioners that are working for me there. I'm managing the practice. And over the last 2 weeks that we have been open, we actually opened right around June 1st, we have had 3 patients approach us, one of which is my wife Jennifer, with a significant problem that I guess I did not realize was as significant as it was, and this is melasma. Now, I'm sure that we all know women that have dark patches on their face, and it can be secondary, as I found out in my research over the last week or so, secondary to hormonal changes. It can be secondary to stress in your life. It can be secondary to aging, and it brings out these dark patches. And the women are very concerned about it because it changes their appearance and it changes the way that they view themselves in public. It makes them feel like they're old, makes them feel like they're aging, and it's of great concern. Now, in the past, we have tried laser treatment, we have tried topical preparations like hydroquinone with only minimal success. It will lighten the patches and even sometimes remove the patches, but the patches come back. And what I've learned in my recent research is the reason for that is there is a higher relative amount of melanocytes in the basement membrane, secondary to senescence or death of the fibroblasts surrounding the area. And this increase, relative increase in melanocytes, cause the hyperpigmentation. Now, when we have treated the skin previously, we have been treating it topically, which will lighten the area of discoloration, but it is not affecting the pathology. And the pathology is in the basement membrane. So unless we can get a change in the basement membrane, the success of the treatment is not there. And the way to do that, according to a new article that was just sent to me by the people at Chimera down in Miramar, Florida. If you're not familiar with Chimera, they are a company that produces exosomes that are derived from the human umbilical cord. And we know that these exosome products were placed under fire by the FDA a little over a year ago. And the FDA says that they cannot be injected if they do not meet the criteria of being autologous, homologous, and minimally manipulated. We cannot inject them. But we know that they can be used topically, and they can be used in topical cosmetic products. And Chimera does have a product called Vive, which is used topically and is used for skin preparations. And this new study, which was just published in February of 2023, shows that if we use topical stem cell derived exosomes after microneedling, so after the vampire facial, we can get long-standing and possibly curative results for melasma. And I think this is a big change in what we've been able to do in the past. I have links to all 3 articles, the one talking about the treatment as well as the 2 talking about the pathology. All are within the last 4 years, so they're all recent studies. I think we finally have something that may make these women happy. It may be able to change their lives, and it's definitely something that we're going to try at Regen Ocala. If you find this research interesting and you have any questions, please reach out to me at any time. I hope you're having a great week and look forward to the weekend. Look forward to talking to you soon. Thanks. Bye.